Hi, I'm Jack Cush with Room Now. This is QD Clinic. QD Clinic is brought to you by RoomNow.live, where it's not just about the data, it's more than connecting the dots, it's about discussing the dots. Cussing and discussing and really getting a chance to interact with your peers and the leaders in the field. So today's case is don't stop. Don't stop believing. Don't cry for me, Argentina. It's about don't stop my damn DMARDs when you got the COVID. This is driving me crazy. Since the beginning of COVID, we put out the message, don't stop your DMARDs, don't stop your biologics, even if you're worried about it. Obviously, if you end up in the hospital, you may have to stop your therapy. But I've had too many patients in the last 3 or 4 months who've had COVID, who stopped their medicine. And most of them were told by other people who know nothing about our drugs, to stop their DMARD biologic targeted synthetic. So I have a methotrexate treated patient doing great on just methotrexate. She goes in the hospital in December, and of course her doctor stopped methotrexate. She's off methotrexate for nearly 3 months, and today she comes in with a TJC of 6 and an SJC of 4. Also today, I have a patient on abatacept. She's doing great on IV abatacept, been taking it for 2 or 3 years with basically remission numbers, and she develops COVID in January. Doesn't go into the hospital, but the doctors who are treating her with nothing other than observation tell her stop the abatacept. Does she call me? No. I would be the last person to call, I guess. And then, last week I had a patient on a JAK inhibitor, doing great on a JAK inhibitor, and they stopped not only the JAK inhibitor, but the nonsteroidal, and the low-dose prednisone. And yes, she came in with 4 tender joints and 8 swollen joints and a high sed rate in CRP, and she's flaring, as you can imagine. Only been off the JAK inhibitor 6 weeks. The point is, this is something that is a big problem right now. The consequences of undelivered medical care during COVID. There's a lot of craziness around what to do when people get COVID. I'm not even talking about what to do with these drugs in the face of giving the vaccine. That's a whole nother cluster, if you will. But here, I think the rules are very clear. Number 1, don't stop the DMARDs. If someone thinks they have COVID, are going to get tested for COVID, you keep taking therapy, because the rule has generally been our patients, inflammatory arthritis patients, and even autoimmune patients have done well continuing their therapies because their disease has been controlled. Inflammation is not in play. When they stop their drugs, inflammation's in play, and it makes everything worse, including COVID infections. Number 2, don't let others tell you how to or what to do with my medicines, meaning don't let the surgeon, the hospitalist, your next door neighbor, the psychiatrist, tell you what to do with your DMARD or biologic. They don't know. They get their education from television, not from reading and studying and researching like you do. So you need to tell your patients, I own this medicine. I'm lending it to you. If someone wants to stop this DMARD biologic targeted synthetic, call me. I'm going to know what to do. Everybody else is just guessing. So number 3, maybe you should get a whole new business card. You, the physician, the rheumatologist. It's going to say, Dr. Jack Cush. And then underneath it's going to say, call me when A, you get sick. B, you go into the hospital. C, you're going to have surgery. Because when those 3 things happen, bad things are going to happen to your therapies at the behest of the idiots that think they know what they're doing. And lastly, shame on you and shame on me for not reaching out and being proactive in instructing all of our patients, not just the ones who you've seen in telemedicine, on what to do during this pandemic. Yes, continue your medicine. No, you don't stop your DMARDs. And then you could give them rules about what they should do when they're going to get the vaccine. That's a whole nother QD clinic. We'll talk about that next. Again, RoomNow.live. Fabulous session. I don't know if you've seen it. The last day on psoriatic arthritis has 3 lectures. Spondylitis, has 3 lectures in the morning. Nigel Haroon from Toronto is going to talk about new advances in therapies. Great speaker. Artie Kavanaugh is talking about what to do with enthesitis and dactylitis. Is there anything you can do? And the session's going to end with Robert Wong, a autoimmune and systemic eye disease guy in Dallas who is going to talk about iritis and B27. And then we're going to have a half hour of Q&A with these people who know everything on those topics. RheumNow.live. Hope you're going to be there.